If anybody needs implants or is even questioning getting them, it's worth the process, it's worth the money. And if they tell me that I have to have the implants on my upper dentures, I would get them. And I wouldn't have anybody else do them except Dr. Sheldon. They're like a family here.
I think the cost was worth every penny, and I would do it all over again.
The cost of the treatment after I got partway through it no longer became an issue because it was not a burden. And also, I now have permanent, lifelong teeth that really are not needing anything but minimal maintenance.
Well, the advice I would give would be this. You have to ask yourself, as the old saying goes, are you sick and tired of being sick and tired? And, you know, if the teeth haven't bothered you, well, I find you don't have an argument. But if you have problems and you're spending a lot of money, and it's like putting a Band-Aid on a cancer, the best thing to do is come in there, have the original teeth taken out, put these teeth in, and you'll be happy forever. I mean, initially up front it appears to be a lot of money, but over the long run you save money. And it's the happiness that goes with it.
The benefit with receiving the full bridge replacements versus the cost, you really can't compare it, because I was having so many problems with dry mouth and trouble eating and my teeth shifting that it was becoming more of a hindrance than a help. So when I look at the cost versus, you know, the hindrances that I was doing, there's just no comparison. It's an investment that you're making in yourself, and that's what's important.
The benefit is a beautiful smile. The cost is worth it. It's like, you know, if you have facial work done, yada, 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 but be able to eat properly, it's very, very important to me for health-wise.
For the amount you spend, I mean, and then the procedure, you know, what they do, I think the benefits, the cost, the benefits outweigh the cost totally, quite a bit.
I had in bridge before, and the bridge every 5 years is like it's being broken, and each time I have to repair it, it costs me 3 times more what it cost in the beginning. And with implants now, that would last much longer, you know. And as far as I see, it works out much cheaper having the implants.
I would advise that if you are recommended to go through the procedure, to not wait. I wasn't going to get anywhere by delaying it. And I had actually been researching the procedure for almost 5 years as to whether it was going to be, you know, beneficial and, of course, cost effective, and what my options were actually going to be. But I wouldn't hesitate. I certainly didn't do it for cosmetic purposes. Some things not about the money. And as far as I'm concerned, my philosophy is all about health. You know, and I plan on being around for a while, and I do need my teeth to eat.
The advice I would give to anyone else who would have to do the same thing that I've went through is it's more than worth it, because partials and everything else are just very uncomfortable, and you know, it's just well worth it.
The cost versus benefit of what I've received from Dr. Sheldon, I would have to say it's a good value. It is a little bit expensive when you're thinking per tooth, but for what it's given me back, I would have to say that the benefit outweighs what it cost.
When you consider value, you really don't think about cost, because the value is everything. My teeth are extremely important to me. They're as important as any limb on my body, and they've allowed me to keep my teeth. And to me, that's a value that you can't put a cost on or a price on.
One of the considerations that I think a person should think about when they have a tooth and have the option of either taking it out and leaving it out would be definitely not to do that. I've done that myself. I had a lot of problems with that. Your teeth begin to move. And what I've found is that it is well worth the investment to have an implant put in, and particularly in an implant if you can, because it's like your regular tooth. With a bridge, you have additional issues that may seem like they wouldn't be a big deal up front, but once you start living with it, it's not a win-win situation in my opinion. I like the feeling of having a real tooth in there, and it feels just like a real tooth. Only better in some ways. It's not going to get a cavity in it.
The benefits to having the implants is you can't put a price on it. I'm enjoying food like I've never have in the last 12 years. I don't have to cut up apples. I can eat corn off the cob. I don't like carrots, but I'm sure I could gnaw right through one and never have to apply any adhesive anymore. It's wonderful.
The advice I'd give to others is don't wait, don't hesitate. You know, just do it, and you're going to be happy with the outcome of this. It's very successful. It's better than your own teeth.
The advice I would give is don't hesitate. I think it's the best decision I've ever made as far as my mouth.